So I had just opened a clinical trial for metastatic hepatocellular carcinoma or liver cancer because there was laboratory data and animal data that suggested that the vitamin C at a pharmacologic dose could be lethal to that type of cancer cell. And so in this case, it was something like we've never seen before. He had a reversal of that metastasis. We believe, based upon the data that we've seen, some of these individual cases that we've reported on, that this could be a very important adjunctive treatment for cancer. Thank you for joining me as we explore frontiers in integrative health. I'm Dr. Dan Monti. Welcome. So we had this 60-year-old patient, a very nice gentleman, who unfortunately had stage 4 metastatic liver cancer. And there's not a lot to do for it. It just continues to grow and metastasize. And in this case, there was a clear metastasis to one of his ribs. And so he had a bony metastasis, we call it. And so there's a tumor sitting on the bone. And there are no treatments that really reverse that. Once it gets outside the liver, it's just unfortunate. There are treatments for liver cancer when it's in the liver. Once it's outside the liver, it's a very hard road. So I had just opened a clinical trial for metastatic hepatocellular carcinoma or liver cancer because there was laboratory data and animal data that suggested that the vitamin C at a pharmacologic dose could be lethal to that type of cancer cell. And we know that most of the healthy tissue is okay with it, especially because the blood level only stays so high for so long. So since that laboratory data had been there, and we had already had good experience of using IV vitamin C in different other scenarios and other clinical trials, we wanted to see if it could help some of these people with stage 4 liver cancer that just don't have anything else. And we enrolled him in it, and we gave him intravenous vitamin C. So what happens is a very interesting but straightforward biochemical process. When you infuse the vitamin C, and it has to be infused. Taking it orally, you'll never get that blood level, no matter how much you take, because your gut will just not absorb it and it'll go right out of you. So you have to infuse it, you get that high blood level, and so what that does is it allows the vitamin C to go out into what we call the extracellular space, or outside the bloodstream to other tissue, say tumors. And when that occurs, a process happens where hydrogen peroxide is formed. We believe that the peroxide is what's lethal to the cancer cells in this process and what leads to the cell death of the tumor cells, but not the healthy tissue around it. The dosage is quite high. We usually dose it by body weight, so there's a variability. I would say the average dose we give in a clinical trial is somewhere between 70 and 100 grams, which is a lot per infusion. The great thing about the IV vitamin C is that it doesn't have the toxicity that other treatments have. In fact, our patients often report they feel better. They feel more energized. They feel like they think better. So most people like getting the treatment, unlike other treatments, and it often dampens some of the side effects of the other treatments that they're getting. We often hear people report that some of the side effects they were getting from their chemotherapy regimen seemed to dampen when we added the IV vitamin C. And so in this case, it was something like we've never seen before. He had a reversal of that metastasis. The tumor actually got significantly smaller, which improved his quality of life. And he actually felt overall better from the vitamin C infusions. Now, we wrote this case up, we published it as part of a larger paper because we wanted the world to know that, hey, there's something here. Now, more research is obviously needed, but this was really an exciting first step in seeing a result in a cancer type that there's just not much to do. We tried this on several patients. Some people responded better than others. Just like any medical treatment, it has a variable response rate, but we've seen it reverse tumor in many people. And when it happens, it's amazing. We also published a phase 1 trial on pancreatic cancer. And we found with the chemotherapy being used at the time, there was actually a synergistic effect. Now, the problem with pancreatic cancer is the primary treatment keeps changing, and so that data couldn't be applied then to the next round of chemotherapy offered for pancreatic cancer. However, there are people around the country who are looking at this very question right now in different tumor types, including pancreatic cancer. We believe, based upon the data that we've seen, some of these individual cases that we've reported on, that this could be a very important adjunctive treatment for cancer. No one thinks it's a standalone treatment, but wouldn't it have been great if we could have given it to a patient like this before the tumor spread outside the liver? And there's lots of groups now starting to look at this and see the importance of this. The National Institutes of Health has a funded trial right now in pancreatic cancer. So we're really looking forward to that data coming out because this is a really exciting field. We know at the Marcus Institute that there are patients who really respond to the IV vitamin C. And so this is one of those things that gives people an edge that we often talk to our patients about. I believe that it wasn't vitamin C that got some of the early results that we've seen, that there would have been a lot of enthusiasm across the entire world to study it more. But there's two problems. One, it's not a pharmaceutical agent, and so it doesn't have the kind of financial support behind it for further development. And so where's the money then to develop it? You have to get that from other sources. And so that's a challenge. The other is that vitamin C in cancer has a controversial past. Back when Linus Pauling was around, two-time Nobel laureate, very smart guy, but he did make some claims about vitamin C and cancer that he had a difficult time proving. And when the Mayo Clinic went to test it, they tested it with oral vitamin C. And Pauling himself didn't understand the difference between intravenous vitamin C and oral vitamin C. So 10 grams of oral vitamin C, which they did in the Pauling Mayo Clinic studies around 1980, orally, if you give the same amount in an infusion, you get up to a 70-fold increase in the blood level of it. Because orally, you're just not going to get much of a bump in the blood level of the vitamin C because it's so tightly controlled in the gut. So not much really happened. And unfortunately, this created some acrimony and a lot of negative dispute that Pauling was at the forefront of. And this led to there being a negative taste in the mouths of the oncology community when it came to vitamin C. So then when my mentor, Mark Levine at the NIH, found in the laboratory and in some of his human studies, hey, wait, this is a whole different animal when we infuse it, people were a little bit hesitant to even think about it or listen to it because it still felt too close to those unfortunate times when Pauling and the Mayo Clinic and the cancer community were all at odds with each other. So now I think that we're far enough past that, and there's enough people looking at this now. And finally, the National Cancer Institute has funded a trial, which they're still doing, but I'm really looking forward to seeing what the results of that are, because that is in pancreatic cancer. We'll see if that phase 2-3 study supports the results of our phase 1 study. And if it does, then that's really going to open up the floodgates of opportunities for patients to get this low toxicity and potentially very helpful treatment as part of the cancer journey. I'm Dr. Dan Monti. Until next time, be well.